ceremony. Kevin Reardon will become the 39th State Fire Marshal when he assumes his duty on Monday. The State Fire Marshal is charged with many duties, including training firefighters, inspecting businesses, investigating suspicious fires, and educating the public about potential problems inside their homes. Kevin Reardon brings a lifetime of experience in public safety matters to the job. From when his career began with the Columbus Fire Department in 1981 to his retirement as battalion chief in 2013, to his most recent job educating and training students for public service and safety careers as director of the Central Ohio Technical College Institute for Public Service and Safety, Kevin brings a wealth of knowledge as well as a passion for public safety to the job. On a personal note, Kevin also worked for me when I was United States Senator as our military liaison as well as our veterans liaison. Kevin, are you ready to be sworn in?
Yes, sir, I am.
Kevin, we got the family there. That's great.
I do.
Fantastic. Kevin, raise your right hand, please, and repeat after me. I, Kevin Reardon.
I, Kevin Reardon.
Do solemnly swear.
Do solemnly swear.
That I will support the Constitution of the United States.
That I will support the Constitution of the United States.
And the Constitution of the State of Ohio.
The Constitution of the State of Ohio.
And will faithfully and impartially.
I will faithfully
and impartially. Discharge and perform.
Discharge and perform.
All the duties incumbent upon me.
All of the duties incumbent upon me.
As State Fire Marshal.
As State Fire Marshal.
For the Ohio Department of Commerce.
In the Ohio Department of Commerce.
According to the best of my ability.
According to the best of my ability.
And understanding.
And understanding.
And this I shall do.
And this I shall do.
As I shall answer unto God.
As I shall answer unto God.
Congratulations, Kevin.
Thank you very much, Governor. I'm
Awesome.
very humbled and honored by this appointment.
Good to see everybody in the family. Hi, Jill.
Hi, Mike.
And Governor, just real quickly, I want to thank my family because none of this would have been possible without their support and their love.
Well, I'm glad they're there. That's fantastic. That is great.
Thanks, Governor.
Thanks, everybody. We'll start with the numbers today. We'll get on the screen. Total cases, an increase of 700. We now have a total cumulative cases of 43,122. Number of hospitalizations, 16% of that. That was an increase of 53. If you look again at the numbers, fairly big jump in the number of cases in the last 24 hours. If you look at the deaths, that is under the 21-day average. If you look at the number of hospitalizations, that also is under the 21-day average, and ICU admissions is also under. So, if we look at the total number of cases, we will see that is a jump, and it's due for probably a number of reasons which we'll talk about. What we have been seeing, however, is statewide a downward trend, and today might just be an exception, but we're seeing a downward trend. But the exception of that is Southwest Ohio, and I talked about Southwest Ohio last week a little bit. Yesterday we talked about Clark County, of course, also in Southwest Ohio, and I want to talk about the counties of Montgomery, Greene, Clark, Warren, and Hamilton counties. And I'm going to go through each one of these counties' data. But we have a group that works, does this every day in the health department, who go through all the numbers and what they supply me and what they supply the director and the local departments as information if they're starting to see trend lines that are worrisome. So the trend lines that we're seeing in these 5 counties are worrisome. Let's just put it that way. Let me start with Montgomery County, and you can see cases going upwards. These numbers we always show as incomplete. So these numbers we would expect to go up. They will go up. We just don't know how much they will go up as the data comes in for those particular days. So you can see a rather dramatic increase from May 25th through June 13th in Montgomery County. You can see on this example the cases have been on the rise for the past several weeks. Some of the latter days are marked incomplete, as I said, because the data is calculated by onset date. This means we don't know this information until a sick person may go to the doctor, which may be several days after the person starts feeling ill. Let me move to the second chart in regard to Montgomery County. This shows simply mobility. People are moving around more. And this is not unique to Montgomery County. You would see this to some degree in if you did any county in the state of Ohio. When we first started looking at these numbers, looks like it was in January, around February 1, I guess. And what you've seen is that the driving went down. Statewide, it went down close to 50%. Here we're showing it looks like about 45% it went down. Then it's gone back up. Driving mobility in Montgomery County has now surpassed pre-COVID-19 levels. So it is back up. Part of that difference is time of year. I suspect that there's more driving in the summer. So again, it just shows you kind of the trend lines that people are, very understandably, it's nice weather, and people are moving around a lot more. Eric, let's look at the next number for Montgomery County. This is by zip code. And these are the zip codes. The red would be the ones that are showing the most cases. These are the zip codes 45424, 45417, 45426. And so you'll see Huber Heights, you'll see Riverside, you'll see parts of Dayton, and you will see Trotwood. We're also there seeing some workplace outbreaks in addition to the community spread. Crocs, for example, distribution center, nursing homes, and a few other places that we're seeing this. Let me turn now to Greene County. Again, Greene County, not nearly as many numbers, but the trend line is the same. Trend line is going up rather dramatically, as you can see here. Two zip codes, basically Fairborn and Xenia. We'll go to the next line. So basically Xenia, where we're seeing numbers, but the real bigger areas is Fairborn. Now it's all over. We have community spread virtually everywhere, but these are the two zip codes that we would particularly worry about in Greene County. Let me move now to Clark County. Look at the Clark County numbers. Again, we're starting to see spikes here. Again, this is incomplete data, so you already see the trend here, and we'll see what happens when these numbers are complete. But you're certainly seeing a trend line there. In Clark County, there's a hot spot, the Dole plant, which we discussed yesterday. Most of those, 95% of those Dole employees actually live in Clark County. There's also an outbreak in a nursing home that had 37 total cases. Let me turn now to Warren County. Look at the numbers from Warren County. Again, you see a jump there. Again, these numbers are not complete. And the team that's looking at this is looking at a lot more data than I'm showing, but I'm just trying to illustrate what we have here. Let's look at the zip codes for Warren. Again, Warren County, you can see, and this is, the numbers are about how many, this is based on residents, basically where people live. So what we are doing is we're sharing this with the counties, and many times they have their own data. They have the same data that we're looking at, so they already know that. We make sure they are seeing that. Let's go to Hamilton County. You see, again, movement up in Hamilton County. Concern about that. Let's look at the zip codes there. And again, you can kind of get a feel for the hot spots. Let me talk now about what our plans are. None of this should come as a real shock. We're going to see hot spots. We're going to see increases in cases at different times in probably different parts of the state. And we don't know, but seeing it move up in southwest Ohio is something we clearly need to respond to. So the action that we're taking, that we have started to take today in regard to southwest Ohio, particularly with those 5 counties, will be what we will do when this occurs in other counties. So we did a conference call this morning. We brought together a number of the mayors. We brought together county officials. We brought together health officials with our team and just really kind of talk through what the plan is. So what we are going to be doing, you're going to see us move in more heavily with the National Guard that will be doing testing in different sites. We're going to work very, very closely with the hospitals in the region, work with them as far as the testing, but also we're going to be doing testing in locations that we will be announcing, that the local news media will be given information about. So we would encourage when you look at these locations, and you'll see this if you live in the Dayton area or if you live in the Cincinnati area, you're going to start seeing in the next several days more information about more places where you can get tests. Again, I want to emphasize we're at a new phase now. We're at a phase where to be aggressive, we have to test more. We now have the capability of testing more. That capacity continues to go up. And so we now can test anybody who wants a test. We would be, particularly if you live in one of these zip codes, we would ask you to get a test. So what we're going to try to do with all the different zip codes that we showed up there that are hot spots where we're seeing an uptick, significant uptick, number of cases, we're going to try to put a place there, kind of a pop-up testing for a day or half a day right in that zip code. Right in that area, so people will be able to get to it close to where they live. So we will be having those announcements as we move forward. We already had a number of testing sites already focused on, and in fact, one of the ones we want to talk about. Let me just go back and look here. You know, I have, as I said, talked with General Harris and the National Guard. Testing is being done today. Just this morning, the Ohio National Guard and Kroger teamed up to provide pop-up testing to anyone at the Department of Public Safety, which is where we are right now, on West Broad. They'll be back again tomorrow from 8 a.m. to 1 p.m. Again, that pop-up testing location is at 1970 West Broad Street at the Department of Public Safety. It will be open Friday from 8 a.m. to 1 p.m. We also have pop-up testing tomorrow in Elyria from 9 a.m. to 3 p.m. at Elyria City Hall, and it's open to anyone who wants a test. You can just show up at that site during that 9 to 3 p.m. time. Again, Elyria City Hall in Elyria tomorrow, 9 to 3. No cost. People can get tested. Here's a slide that shows a list of pop-up sites for next week, including Portsmouth at the Compass Community Health Center, in Xenia at the Greene County Health Center, in Dayton at the Samaritan Health Center. For more pop-up testing center locations near you, as well as community health center information and retail testing, please visit our website at coronavirus.ohio.gov, coronavirus.ohio.gov. Click on testing and community health centers at the top of the page. Now, again, in addition to these locations, in the next several days, we will be announcing, this will be available through the news media in the Dayton area, and in the Cincinnati area, additional testing locations. And our goal within the next 10 days is to have testing sites open for half a day or day or maybe longer in each one of the zip codes that we identified as being hot areas that we are particularly concerned about. But anybody, whether you live in that zip code or not, you can go and be tested there. Let me move to announcement about hospital readiness, PPE stockpile. As we continue reopening Ohio, it's important that we also continue to build up PPE supplies, specifically for our more vulnerable Ohioans. Today, I'd like to announce a new hospital PPE readiness stockpile. This stockpile will be compiled and stored by Ohio hospitals throughout the state and will be distributed to residents and staff at long-term care facilities should they see a spike in COVID-19 cases. We want to make sure everybody has enough of the PPE. Stockpile is a collaborative effort between the Ohio Hospital Association, hospitals throughout the state, several state agencies, including the Ohio Department of Health, Ohio Department of Medicaid, and Public Safety. In addition to hospitals' own PPE inventory, they have also started to build a 30-day reserve of PPE based off of several calculations, including the state's surge models, number of residents and staff at Ohio nursing homes, as well as recent FEMA PPE allocations to each Ohio nursing home. Each hospital will have a different amount of stockpile that's calculated specifically for that hospital and for that region. The stockpile will be tracked daily by the Ohio Hospital Association's resource tracker, confirming that each hospital has met its target amount and can be distributed when necessary. Having a stockpile like this is really important. And this type of coordination just simply did not exist 2 months ago. And so we're building a lot of this coordination as we go. I want to thank the hospitals for sharing their data, thank the hospitals for sharing the information and working very closely with us. I want to now ask Dr. Amy Edwards to join us. We're Skyping in Dr. Amy Edwards, who is a pediatric infectious disease doctor and Associate Medical Director for Infection Control at University Hospitals Rainbow Babies and Children's Hospital in Cleveland. Dr. Edwards typically focuses on prevention of hospital-acquired infection and transplant infection diseases, but during the pandemic, she's been caring for children who test positive for COVID-19. She's also headed up the task force that established diagnostic and treatment guidelines for multisystem inflammatory syndrome in children as related to COVID-19. During the past couple of weeks, Dr. Edwards noticed a disturbing trend at Rainbow Babies throughout the pandemic. As we have talked about, very small number of children have been very sick. Typically only 1% to 2% of children there were testing positive for coronavirus. Doctor has started to see some changes in that. But Doctor, I wonder if you could first maybe start in talking about the overall situation with children. We have been proceeding on the assumption, and the data has shown that children generally do not get very sick if they do in fact get the coronavirus. And so I wonder if you could just talk a little bit about that, and also what you have seen and what some of the new things are that you're observing, new problems you're observing with some children. Thanks for joining us.
Oh, thanks for having me, Governor DeWine. So for coronavirus in general in children, you're absolutely right. The vast majority of children are going to do great. They're either going to have asymptomatic or what we call polysymptomatic disease, which is, very minimal symptoms, which is typical for kids with respiratory viruses. And certainly, even with some of this new data coming in, children are nowhere near as affected as the older age groups, which, of course, I'm eternally grateful for. But in recent weeks, or maybe for the last month or two, what we've been seeing is an increase in the number of kids who are testing positive for coronavirus. Initially, some of that certainly could be laid down to increased testing as we were working together with the state and other institutions to increase our testing. Of course, we captured more kids because we were testing more kids. But what we've really been seeing recently is an increase in the percent of tests that are coming back positive, particularly in symptomatic children, meaning that for kids who have symptoms of a respiratory viral disease, a larger percent of them are coronavirus than earlier in the pandemic. And, you know, it's to be expected as the state opens that we're going to start to see more positive kids, but that rate has been going up. It's something we're keeping our eye on. It hasn't gone up dramatically, about 5-6% or so, but it has been a steady increase, and it has not stopped increasing as of yet. We gather data every day, basically. And together with that, we have seen a slight uptick in hospital admissions for COVID-19 in children.
Well, Doctor, as a parent and now grandparent, but not directing it necessarily to me, but to anybody who's watching today, if I'm a parent and I have little kids, what do I look for? And you know, that's always it seems to me is always the question as a parent. What should I look for? What am I to be on the alert for? And then how do I react if I see it?
Well, with kids, the symptoms actually aren't that dissimilar from adults. It's a respiratory virus, so you're looking for respiratory symptoms: cough, runny nose, shortness of breath, of course, fever, that sort of thing. Kids get this all the time, right? Any parent or grandparent can tell you that kids are always running around with a little bit of a stuffy nose. So if it's mild, if it's something that you feel like you can manage at home with your pediatrician, you may not do anything differently at all. But obviously, if your child seems to be having a little bit more trouble breathing than they normally do, if they're having trouble with their appetite, they're not eating and drinking as much as they should, then you might want to talk to your pediatrician about it. As you mentioned before, you know, anybody that wants to be tested can be tested. Certainly, that's our policy here at Rainbow. We've liberalized our testing such that any child with symptoms can now be tested, not just the ones who are admitted to the hospital. And so if you're worried at all, just let your pediatrician know, and we can certainly get your child tested.
Okay, great. Anything else that you think we should know? Anything else you'd like to tell our viewers out there and listeners?
The only other thing I'd like to say is, you know, as we've been seeing the increase in coronavirus, so too we've been seeing, you know, more cases of this inflammatory syndrome that you mentioned, the multi-system inflammatory syndrome in children. And so I do want to remind parents to keep an eye out for that. The symptoms of that are, you know, high fever and GI symptoms like nausea, vomiting, diarrhea, stomach pains, rash, red eyes, that sort of stuff. We have information about that on our website, at the Rainbow Babies and Children's website, including a frequently asked questions section for parents. But I do want parents to keep an eye out for that too, not just for COVID.
Okay, and what about a child that has asthma? Anything in particular to watch for, or just be more alert about, or?
So we've had some kids come in with asthma exacerbation secondary to COVID, and that actually seems to be the part that's pretty standard. The kids come in with their usual asthma exacerbations, and they respond to albuterol much as they always do. So at least here at Rainbow, we haven't seen anything different with our asthmatics. It's just another respiratory virus that can trigger their asthma.
Dr. Edwards, thank you very, very much. We'll let you get back to helping kids, but thank you. We appreciate it.
You're welcome.
Thank you very much. Lieutenant Governor.
Thank you, Governor. A lot of great information there. That information on the PPE stockpile is just great news. It's amazing how quickly the team responded to that, and that will really prepare us going forward. So that's great news. I have a couple of things to talk about today. Actually, a couple of my favorite topics. We're going to be talking about jobs and sports. And let me first talk about the jobs component. There's going to be a transition. You know, during the peak of the coronavirus, we created a job site, coronavirus.ohio.gov/job search, because we had essential businesses that were really in the healthcare space and the food supply chain that really needed to hire, and to hire quickly. So we created an opportunity to do that. But as the economy has reopened and we're beginning that long journey of recovery in the job market, employers' needs, job seekers' needs are changing, so we're transitioning. Just to give you a little data behind what's going on, as people are heading back to work, the Ohio Department of Job and Family Services released their weekly data today, showing that for the 7th straight week, we continue to see weekly claims for continued unemployment benefits have declined. And there are 287,000 fewer claims than when we were at our peak in April, and the number of initial claims rate continues to decline. So we are transitioning from the coronavirus.ohio.gov website, our job search website, back to ohiomeansjobs.com. Really, it is a great resource for employers to try to attract employees and for people who are out there looking for work to find jobs. At Ohio Means Jobs right now, we have over 120,000 job openings, 120,000 job openings, and almost half of those pay $50,000 a year or more. 76,000 of these jobs require less than a bachelor's degree, and 36,000 either require a bachelor's or associate's degree. Another important and interesting stat here, 92,427 of those jobs, or 77% of them, are considered in demand. So these are the ones that we know are just employers need these skills, and we're really trying to help align our training programs and our job search programs behind them. So this is a place to hire people and to get hired, serves employers and job seekers, the jobs will still be live at coronavirus.ohio.gov/job search for only 14 more days, but transition, go to ohiomeansjobs.com to find out the information that you need to about posting jobs or finding them. Now, on sports, we, back in May, announced the beginning of a 3-phase transition back to competition. On May 26th, we opened sports back up for skills training, physical skills training, in conjunction with our working group and the Ohio High School Athletic Association. We're now announcing the next phase of this. Phase 2 will reopen contact practice for all sports. This means basketball, football, lacrosse, and other contact sports can resume scrimmages and full training regiments as long as the safety protocols are observed. This start date for phase 2 will be June the 22nd, next week, June the 22nd. The goal's clear. We want people to continue to, particularly young people who need to do this physically, to physically develop the strength and agility skills that they need for future competition. Got to get you trained and ready so that we can avoid injuries and that you'll be ready to go when that day comes in the future. Reminder that June 22nd is the day that contact practice may begin, but it will be up to your local school, your local sports organizers to determine the best time to proceed. The specifics on the training guidance, which is very straightforward, will be updated soon at the coronavirus.ohio.gov website. And I want to again thank the Ohio High School Athletic Association for their great collaboration in this to make sure that we're all aligned, taking care of our young people, getting them back busy, doing the things that they want to do, physically fit, building the character, doing all the great things that athletic competition does for young people, and some of us who are a little older too, I guess. But we appreciate that collaboration with our working group and the Ohio High School Athletic Association, and it's great to see that we're going to be able to take that next step starting next week. Thank you.
Great.
Governor?
John, thank you. Ready for questions?
Hey, Governor. Kevin Landers, WBNS-TV. I just kind of want to follow up from what you mentioned yesterday. You'd mentioned the Ohio Legislative Black Caucus was played a role in your reforms that you announced yesterday, but they also sent out a statement saying that black lawmakers were not consulted or given an opportunity to offer input about your reforms, and were only told about hours before your announcement. So I wondered if you could clarify that first about their involvement in your decision. And just in terms of the COVID numbers, I know we had a spike today of 700 cases. Other states have seen much higher numbers. Do you have any explanation as to why Ohio isn't seeing those numbers jump, and whether or not you're reconsidering people coming into Ohio to self-quarantine. Thanks.
Well, first of all, I'll take your first question. Look, I'm not going to get into a public argument with my friends in the legislature, so you know, I'm not going to contradict what they said. But you know, this is very much a work in progress. So I think everyone has my cell phone. I think all the members of the legislature have either my cell phone or my email, and we welcome for them to get in contact with me. Welcome for them to get into contact with Dan McCarthy, anybody on our team, Andy. And so, you know, our door is open. This is a work in progress. This is something where the legislature will work its will. We will have, I'm sure they will have hearings. This is what we want them to do. What we tried to lay out yesterday is some of the things that have been talked about for a long time. I do not claim any originality for most of those things, but we wanted to work them out and put them in a package so that they could be acted upon by the General Assembly. I'm sure the General Assembly will work its will. I'm sure the General Assembly will add things. Some things they will change. And that discussion is important. And so we've started that discussion, and we're going to continue that discussion. As far as why Ohio has not been hit as hard as some other states, it is very complicated, and I do not pretend to have all the answers. And what we have tried to do throughout this, from our first press conference till today, is to share with the people of the state of Ohio and with you everything we know, all the data we know, and we're going to continue to try to do that. We have to be in this for the long run, and Ohioans have done amazingly well. Ohioans stayed home for a period of time. Ohioans have kept distancing. So I give a great deal of credit to the people of the state of Ohio where we are today. We're now in a different phase. We're now in a phase of how do we live with this and still be able to work and still go about our lives. And Ohioans are working their way through that. I just continue to encourage Ohioans, you know, this thing is not over. It's still out there. If we needed a reminder what's going on in Southwest Ohio now, in the Dayton area and Cincinnati area, this is a stark reminder that this virus is very much with us. Much as we would like to get rid of it, it is still here. It is still preying on people, and the potential for it to spread even more is certainly there if we do not continue to guard against that, if we do not continue to be careful. So this is a work in progress. We cannot declare victory. This is something we have to continue to work on every day.
Hi, Governor. It's Andrew Welsh-Huggins with the Associated Press. I had a quick question for you on the Law Enforcement Recruitment Office that you announced. One issue that often is raised as an obstacle to diversifying police departments is the fact that minority candidates are sometimes filtered out up front, whether through racially biased civil service exams or background investigations that might eliminate otherwise strong candidates because of things on their records like drug use or low credit scores that actually could be the result of discriminatory policing or racial profiling in the first place. So my question is just, how might the recruitment office address that kind of early filtering out that sometimes happens? And are there any other initiatives you would support in that regard?
I think that's a very good point. And in fact, I got an email this morning from a chief of police in Ohio who made the exact point that you just made. So I think as we look to diversify our law enforcement, we want good people. We want good people. But if someone has had a problem a number of years ago, we probably should not put artificial automatic barriers in there, that everyone should be judged by, where they are today in their life. Now, there'll be some exceptions to that, and we can all come up with our own exceptions. But I think this is something we didn't talk about yesterday. I didn't talk about it. But this is an example as this discussion continues, how we can expand the discussion, and smart people can add things like that to it. So I think it's very much an issue, and it should be addressed. And we are certainly looking at it. And I'm sure the General Assembly will look at it as well. And frankly, local police departments have got to look at it. I mean, what we cannot forget is that we can set basic standards. We can do certain things at the state level, but ultimately we have over 800 police departments in the state of Ohio. And so it's the mayors, it's the councils, city managers, all the people involved at the local level who really have to be part of this discussion. Point.
Good afternoon, Governor. Jeff Reddick from ABC 6 News here in Columbus. A lot of our viewers have questioned, there is still the prohibition on the very large gatherings, and they understand that, but the small to intermediate gatherings, people, in groups of a little more than 10 up to a couple of hundred people, things like graduation parties, weddings, they just want to know if there's any concrete guidance you can give on if those gatherings can go on and what the conditions are for those gatherings.
Well, as we certainly have carved out some exceptions to a lot of these things, but I think that, if it was my family and we face the same issues that other people face, I think distance is the key. Outside is better. Now it's summer. Outside is better than inside. A mask is better than no mask. I mean, these are just basic things, and when you put them all together, I think people, can kind of figure out where, as a family, they should be. I think the other thing that family members have done, or families have done, is they've kind of figured out, okay, who are we going to be with? Who's kind of our tribe or our group, and not tribe in a classic sense, but just who's our grouping? And people are making decisions based upon that. Life has to go on. They have to have contact. You have to have social contacts. Kids have to be able to play ball. So people are just kind of making these decisions using their common sense and making their judgment based on their particular family situation. And so that's what we do in our family, and that's what I would suggest that people do.
Hi, Governor DeWine. This is Laura Hancock from Cleveland.com. My question is, with this recent outbreak, the hot spot within the outbreak that you announced in the Dayton and Cincinnati area, why did you choose to not scale back some of the reopening, space them out? What was your thinking on that? It looks like you're just doing testing.
Look, we have tools, and we have a couple tools. First of all, and we're really, by making this announcement today, we're using two tools. One is to inform the public and inform people who live not just in those counties, but in those zip codes. If you see that zip code, that should be a warning to you, hey, I need to get a test. Second, I need to be careful. There's obviously community spread going on in the area where I live. So it is informing people and keeping them informed so they can make their own judgments. So that's a significant tool. The second tool is the testing itself. We will now surge testing in there. I am confident that if people will go get tested, we will stand there. National Guard will stay there day after day, whatever it's going to take to get people tested. If people want to come and get tested, it's free. They can do that. So those are two tools. The third tool would be the much more cumbersome tool and the much more tougher tool, which is, as governor and Lance Himes as director of health would order something. We don't want to do that unless it's just last resort. I mean, we don't want to do that. We went through that in the closing. We did things that we thought made sense and did them in a logical order. Now that we have opened most everything, that is a tougher tool to use. It doesn't mean that, you know, I don't rule anything out, but persuading people and talking to people and giving people the facts, it seems to me, is the right thing to do to start with. And the other right thing to do is to take the responsibility that I have, and the ability I have is to surge testing into a hot spot in an area and work with the mayors, work with Nan Whaley in Dayton, John Cranley in Cincinnati, and the other, Mary McDonald and others in those areas, and try to work through them to get things done. So that's what we're doing. That's why we're doing it.
Jack Windsor, WMFD TV in Mansfield. My question is for the governor. Governor, Dr. Amy Acton is now in a new role as Chief Health Advisor, a newly created position with an annual salary of $236,000. Dr. Patrick Oliver is also in a newly created position that will require funding, which we've requested information on. Can you justify to Ohio taxpayers how the state created new positions when there's a freeze on state hiring, and at the same time you've cut money for education, clawed back unemployment benefits for 23,000 Ohioans, and borrowed money from the federal government due to insolvency?
Jack, thanks for the question. Look, we have an obligation to make cuts. We have made cuts. We're going to continue to do what we have to do to balance the budget. But we also have to fight the COVID-19, and we also have to take actions that we know are past due in dealing with some of the challenges connected with our police. So governing is about making choices. When you elect a governor, when you elect a legislature, you elect a president, it's about people make choices. And the choices that we have made is that these two slots are important. These help us fight the COVID. They help us rectify some long-standing problems in conjunction with our police. They also happen to be two people I've worked with in the past, and so we make those choices, and that's what we did, and that's my job as governor, is to make those choices, and that's what we've done. But ultimately, we have made tough decisions in regard to spending. We don't shy away from them. We'll continue to do those. You know, in regard to education, as I said at the time, that's the most painful cut. It's always the most painful cut. We wanted to do it up front so that we would give the schools a heads up of what was going on, and with the goal, we hope, of not seeing major cuts as we move forward with the schools. That's our goal. We'll see where the economy is going, but we wanted the schools to be on a more predictable level. And that's why we made that decision. We made it early on.
Hello, Governor. Jim Province with the Toledo Blade. This question is for you and for your Lieutenant Governor. You have asked union employees to come back and present some plans for concessions, possibly pay cuts. You've also ordered pay cuts and furlough days for exempt state employees. Would you and your Lieutenant Governor volunteer to take pay cuts yourselves, if only to show solidarity with these employees? And should other elected officials do the same?
Yeah, my understanding, according to our legal counsel, is that I can't take a pay cut directly. But, you know, I've told our team that we will write a check back, or whatever the lawyers tell us to do for that 4%. We certainly will do that. Fran and I have also decided that we will take 1/2 of my salary and donate it to charity, and we will do that as we move forward every month.
Add that I actually signed the paperwork this morning informing them to deduct 4% from my salary as well. So we're aligned with what we're asking everybody else to do.
I'd like to see other state elected officials do the same.
I think they can speak for themselves. I'll speak for the governor, and the lieutenant governor will speak for the lieutenant governor. So
thank you.
Hello, Governor. This is Shane Stegmiller from Hannah News Service. Earlier this week, the FDA withdrew its emergency authorization for hydroxychloroquine. In the early days, Ohio, like many other states, started a stockpile of it in case it was a drug that could be used to treat it. In light of what the FDA has done, what do you plan to do with that stockpile? What is the next step?
Yeah, you know, the health department is looking at, you know, what the best practice should be and what they should do. Hindsight's always perfect. If you knew what the FDA was going to do this week, you know, obviously you would not have stockpiled that. On the other hand, if it had turned out that we couldn't get it, people would have looked back and said, why didn't you stockpile it? So, you know, you're going to make errors as you move forward. As you fight a pandemic, things are not going to be perfect. And so in hindsight, we wouldn't have done it, but we went on the best available information that we had at the time. And we erred on the side of being cautious to protect Ohioans' lives. We wanted to make sure we had it if we needed it. So they're going to work and see. It does have a shelf life. I forget what the shelf life is, 12 months or something like that. But obviously they have to work against that shelf life and try to use it in the proper way and the approved way the best they can.
As just a quick follow-up, how much do you watch some of these studies that are coming out talking about other drugs that quite possibly could be used? Do you try and stockpile any of those drugs as well as you see these studies come out? Talking about like remdesivir and those drugs.
Well, I'm certainly not the doctor and not the medical expert, and so you know we rely a lot on the folks at the health department to look at these. We also, though, rely on hospitals. You know, one of the things that when people ask me, who do you listen to, you know, we listen certainly to the health director and Dr. Acton, Lance Himes, but we listen to a lot of people. You know, I'm on conference calls with doctors. I'm on conference calls with representatives from hospitals. So, you know, a lot of people are weighing in on these particular decisions. But particular decision about what to stockpile is probably not going to be my decision. It's going to be made by someone else.
Governor.
Good afternoon, Governor. John Reed, Gongwer News Service. There have been a lot of concerns from long-term care providers, nursing home providers, that the combination of lost revenue and increased costs from this is going to put a lot of those businesses out of business. Are you worried about the long-term effects and access to care after this is over?
Well, we've been working with long-term care facilities on trying to help them. We know that this has been a difficult time. We also know that the quality of care that can be supplied to our family members, our loved ones, does certainly to some extent is impacted by the money that goes to these nursing homes. So that is something that we watch very, very closely. We try to watch taxpayers' dollars, but at the same time, we understand that money flowing to those nursing homes through Medicaid, for example, you know, determines certainly to some extent the quality of care that people are able to obtain there. And so it remains a balancing thing. So we're always concerned about that. I mean, that's, you know, whatever's going on, you're concerned. You're concerned that nursing homes have the resources they need to take care of people.
Good afternoon. This is Jackie Borchert from the Cincinnati Enquirer. I have a question about the 5 counties you mentioned where you're seeing some worrisome increases. I'm wondering, in addition to the workplace hotspots you mentioned, if you have any other insight on what is driving these increases, if there are certain events that have led to more positive cases, things that people should be watching out for.
Well, we had one case where we had a visiting minister who was going from several different churches, and unfortunately, that was spread that way. You know, you do have examples of a spread that's occurring where you do see a particular hot spot, you know, in a factory or a Dole factory, for example. But a lot of times the health experts tell me that also indicates that you have community spread anyway. It might manifest itself there, but you probably also have community spread outside. You also have, in some of these cases, you have people riding to work together. So it's all kinds of different things, and that's the exact question that you just asked is the question I asked my team. What is driving this? And what I have seen, at least anecdotally, so far, is that the answers are all over the place. They're anecdotal. It's easy to see if you've got one company where you're seeing a lot of it, but even when you're seeing a spike in a company, it doesn't mean they're doing anything wrong there. It could just be that you have people who are working together, who are riding together, and it gets into the factory, and then it just takes off. So we should not, when we hear these stories about a nursing home or we hear these stories about a company, we should not automatically assume that there's no community spread beyond that. Because what the experts tell me is generally you're going to see community spread in that community as well. So we shouldn't listen to that and say, I don't have anybody in that nursing home, I don't have anything to worry about. Because you have people who work in that nursing home who are going out into the community all the time. The same way would be a factory. Oh, I don't have anybody that works in that factory. Gee, I can turn it off now. I don't have to listen to the news. Well, that's not true because those people go out into the community and it spreads. So the community spread is here. We knew, we learned constantly about this virus. We've said all along we're going to continue to learn more as we move forward, and we will. But I think most people felt that by this point of the epidemic, the community spread would be fairly widespread, and in most communities it is.
That happened in the last few weeks?
The answer to that question, but it's a question that I keep asking as well. So I will re-ask that, and my guess is we'll start knowing one way or the other if we can link that or do see any linkage at all.
Thank you.
We know.
Adrienne Robbins, NBC4, and my question's for the governor. As cases rise in some states like Florida and many people are taking their summer vacations, are you considering re-implementing travel restrictions like asking people to quarantine if they're going to be coming back from some of those states?
We've made no decision on that, but I think you make a very, very good point, and that is, if you're in a state, if you're going to go visit a state that is seeing an uptick, significant uptick in cases, be careful. You might want to dramatically restrict the people you come in contact with in that state. You might want to think about not going to that state. So these are, again, are personal decisions, but I think we should be mindful of what is going on in the states. And the good thing today, because of the media, because of social media and everything else, we pretty much know the numbers are there, and you can see where there's an uptick going on. We have some members of our family who, are in Florida. Their family, but they've been very, very careful not to go out much. They go on the beach, they stay away from people. I mean, that's, the wise thing to do is just be very, very careful and be mindful where you are. It's everywhere. There's community spread. You can assume that everywhere, but certainly some places are more than other places. Be careful.
Governor, this is Rick Reardon from the Columbus Dispatch, and I am the last question today. Hopefully it's pretty straightforward for you. When do you expect to open prisons to visitations again?
I'm sorry. When do I expect to what?
Open prisons to visitations?
That is a question that I generally leave up to the director. She comes with recommendations. I know that there is a concern about it. We are concerned about it. We're not only concerned about visitation in prisons, we are concerned about visitation in nursing homes. I get a lot of calls, letters, emails about that, and this is something that we are working on and we should have something to share with you in the next week about all of those. These are balancing questions. These are probably the most gut-wrenching decisions that we make, and they just kind of tear you up because you see stories and you hear stories, and people write to me and they tell me, you know, they can't see their loved one, and we know how tough that is. But we also know that over 70% of our deaths have come in nursing homes, and we want to do everything we can to keep the COVID out of those nursing homes. So thank you very much. We look forward to seeing everybody, barring something unforeseen that takes place. Our next scheduled news conference will be Tuesday at 2 o'clock. Hope everybody has a good weekend. Thank you.